Well, we all fear something in life and we live with such knowledge. However, excessive irrational fear is another reaction which can interfere with normal living. Well, phobia is defined as being excessive fear towards something which grips many people. Such fear is believed to be linked to the psychology. Well, to help us unpack further details on this is clinical psychologist Mr. Tony. Mr. Tony, thank you so much for joining us this morning right here on 8 and welcome to our studios. Well, phobias are defined as being excessive fear towards something. Just unpack further details on what exactly phobia is.
Well, as you mentioned, it is an unrealistic, irrational fear of a particular object, a particular situation, particular activity, which the person would avoid at all costs. And where they can't do so, then they would experience severe anxiety and possibly even panic attacks.
Now, I might be scared of balloons, someone else might be scared of snakes, other people might be scared of heights, and it's all different stuff. Other people might be scared of germs even.
Yeah.
Just talk us through the different types of phobias that there is, because they all seem to be very different.
Yeah, well, one of the predominant category is social phobia, where people have a fear of presentation, talking in public, meeting people and strangers. Then we have agoraphobia, where people are afraid of open spaces where they can't get out. And then you have your specific phobias. And here there are apparently between 100 and 200 of these sort of specific types of fears, ranging. The most common one that people would note would be the zoophobia, fears of animals, yeah, dogs, rats, mice, and so forth. So that's basically those three categories. It occurs in about 7 to 13% of the population in the Western world. In America, about 6 million people suffer from different types of phobias. So it is prevalent. I think the problem is that a lot of people will not talk about their phobias because they're avoiding them, and it's not nice to admit that you have this particular phobia.
That is very true. You know, some people might not even want to express that they are scared of certain things, which I think there is an underlying cause of all these phobias. So just talk us through the causes of such.
Well, the causes, in my experience as a clinician over many years, is usually some form of traumatic event in the past that becomes then associated, almost conditioned to that particular stimulus. Whether it's being trapped in a small confined space like a lift or wherever, but that's my experience. But some research has shown that there is a link to family history. Some people even suggest some type of kind of possible genetics.
Yeah. Some people get their phobias when they're very young, and as they grow older, they start getting used to their fears, or rather letting go of their fears.
Yes.
What are the possible treatments of those people who actually grow up with those fears, or rather those phobias?
Yes, well, it depends how well a lot of people manage to avoid their phobia until they get to such a point in their social or occupational life where they have to deal with it. For example, have to go up lifts or have to make presentations. That's one of the phobias that I have to treat quite often in my own professional life, is a sort of presentation. Talking in public, having to do, like managers having to present reports to boards and things like that, and that's where they then have to face their phobias.
And just give us more details on how the entire treatment process works and how long can it take actually to heal a person from phobias? Yeah,
well, look, the most well-researched type of therapy is cognitive behavior therapy, CBT. Which would look at trying to help desensitize the person to the particular phobia using different techniques. All of these techniques will involve some form of exposure to the phobic stimulus, as well as then teaching the person to be able to control their anxiety in the face of such a stimulus.
And just talk us through whether with regards, are there any awareness campaigns which are conducted at primary schools to actually teach young kids, or should there be any awareness campaigns to teach young kids about phobias and the understanding of of the different personalities and the phobias that people have?
Well, certainly not phobia specifically. I know that and I'm involved with the South African Depression and Anxiety Group, and they do a lot of good work as an NGO in trying to just conscientize people to mental illness generally and different forms like depression, anxiety, and obviously included that would be phobias. But there's a lot of work to be done there. A lot of work still to be done.
And what are the counter effects, or rather the after effects of forcefully forcing people with phobias to face up to their fears? Let's say a person is scared of snakes, and you just forcefully show them a picture of a snake, or is there any after effects or dire after effects of such?
No, well, obviously it's traumatic for them, and they may well then experience a possible panic attack with the symptoms, breathing, heart palpitations, nausea, dizziness, numbness. Very often, phobia patients land up in casualty wards, and the panic attacks often get misdiagnosed as possible heart attacks, and then they go through a whole lot of tests, etc., until perhaps after the second or third episode, people realize, no, well, this is not necessarily a medical condition, but it's actually a psychological condition.
Well, Mr. Tony, thank you so much for speaking to us this morning right here on 8 and 7. It's been an absolute pleasure to have you with us. Well, that was Mr. Tony, just unpacking more details